Our next speaker is Robert Ellis Hutchings. Dr. Ellis Hutchings is a toxicologist at the Dow Chemical Company. Over to you, Dr. Ellis Hutchings.
All right, thank you very much. Okay, good. I want to thank the organizing committee. I want to thank Heather as well as the rest of the organizing committee from the NAS Food Forum for the invitation to speak today. It's a real pleasure. And I wanted to also thank Kara and Stacy for putting together such a great introduction. I think I'm hoping that I can build off of it sufficiently well. And just as way of disclosure, I am an employee of Dow Chemical Company. We produce a variety of materials, and that includes plastics. Namely, what I want to start out with is just to set the stage about the proliferation of scientific publications in the microplastic space. Kara gave a great introduction in regards to the timeline of macroplastic as well as microplastics. A little bit here on the science side about effects. Starting on the environmental side, you see that showing up in the timeline around 2006. But there's a delay on the human health side to the point that you don't really start to see human health publications showing up until later, typically around 2014 or so. So we really have about 5 or 6 years of data to start looking at the side of human health. The other thing to be aware of is if you look at just this year's publications, the vast majority of them are reviews, also environmental monitoring publications. And so when we're starting to look at aspects of health, we have a very limited data set still to draw upon. And just one other way of looking at this, this is from a publication that looked at the numbers of studies within a 5-year period, 2016 to 2020. You can see that only 2% of those publications were human health related. So the context here is that there's a small pool of studies to draw from when we're looking at human health. But the amount of publications is expanding exponentially. So I wanted to take a moment to give some context of where is the science being conducted. And what you can see on this slide here is that 40% approximately of the publications are coming out of China. That is a big number. And the other major area in which microplastics and human health science is being funded and conducted is in the area of the European Union and Europe. You see here that it's over 56 million euros that are being used to fund microplastic studies. And these are both on the environmental and the human health side of things. The number is actually higher than that because every day there's new science projects that are being announced. Not only in China and Europe, but we also have, there's active programs in other countries such as Canada and the US and et cetera. So there is an enormous amount of science that's being generated in this area. And that is good news because as you just heard from Stacy, there are deficiencies in terms of the quality and the standardization of the studies that exist to date. So what I want to focus on today really is the question of what is the impact of microplastics on human health? And really to answer that question, we need to ask a series of, or answer a series of other questions. So from top left, I'll just circle around. If we first look at external exposure, which Stacy covered, what's the actual exposure in food and drinks? We need to know that to put things into context. Once we have an understanding of what the exposure is on the external side, we need to look at what is consumed or ingested. If we're thinking about food, what's the internal exposure? In here, we're thinking about what's absorbed or taken up into the biological system. How is that distributed around the body for those that can get absorbed? And what is excreted? You notice that for those of you that are human health folks, we often talk about ADME, we talk about metabolism. In this space, there isn't really much metabolism that we would talk about. Really what we're focusing on is there are modifications of the microplastics or nanoplastics that can occur in the biological system, and that's expected to be very dynamic, whether it's in the stomach, the small intestine, the blood, the tissue. Would be expected to be a dynamic situation and not static in that regard. So say, for instance, a microplastic has been internalized. Now we want to understand what potential health effects could be caused by that microplastics. We think of adverse effects versus non-adverse effects and hazard. So one area could be point of contact type effects in the stomach itself. Other effects, once you have systemic exposure, could be in the liver, thyroid, I have shown here, but other tissues are needing to be examined as well. And lastly, once you've understood if there's an adverse effect or a hazard effect of microplastics, you need to put that into context. So we need to understand the exposure, as I started with here, but we need to understand at what concentrations and conditions do we have adversity. And how do those relate to each other? Is the effect level for hazard similar, or is it much higher than what is known in regards to the exposure? So there's a lot going on in really answering this question of impact on human health. Really, for today's talk, I'm really going to focus on the internal exposure side as well as the effect side. So where does it start? It starts really from, we talk about microparticles or microplastics, it starts in the small intestine. This is a biology 101 point here, that the small intestine is composed of a very high surface area. And you've got these finger-like projections, villi in the small intestines, and that allows for a big
You're breaking
surface.
up a little bit, Dr. Ellis.
Oh, I'm sorry.
Perhaps turn off your video.
Sure, we can try that. Please let me know if there's any other problems. All right, so in the small intestine, you've got these villi, and that is composed of, on the epithelial cell side, you've got microvilli that extend out into the luminal space. And those epithelial cells form a very effective barrier to entry at the intestine. And you'll see that there are tight junctions between each of the epithelial cells. And you've also got a mucus layer that is covering the intestinal lining. While this is a very effective barrier for most particles, you also have aspects of the GI tract where there's discontinuity. So there are other cell types present, such as these microfold cells that are located in areas called Peyer's patches. And these cell types are lymphoid tissue. So you've got the interaction with the immune system there. And that is hypothesized to be a key area for microplastic uptake. I would say both these areas are good contributors for the potential for uptake. So a little of this has already been covered, but if we think about the European Food Safety Agency, they have concluded that particles that are less than 1.5 microns have the potential to penetrate the barrier. I'm focusing on size here because that is recognized to be the most important determinant of uptake of microplastics. If we think of the initial barrier, the epithelial cell, at a 1 to 2 micron particle size, it's been estimated that 0.13 to 1% of those particles can be taken up or pass over the gastrointestinal barrier. What that means that for at least for this particle size, you're looking at 99% of the particles not being absorbed and being directly excreted. Now, as the particle size gets smaller, you can, it's safe to assume that there will be the potential for increased uptake, but we don't have good numbers on that to date. There are, besides size, a number of modulating factors in play. Those include surface properties of the micro or nanoplastic themselves, shape of the material, as that's been mentioned already. Diet and lifestyle can be a modulating factor, and there are reports that pregnancy or lactation can can have a modulating factor and potentially increase the uptake to some extent. There's a lot of uncertainty around these numbers, and there's a lot of limitations in regards to the diversity of particle or microplastics that have been used in these experiments to date. So there's a lot of information that's still needed to draw more definitive conclusions. So just to sum up the internal exposure side of things, I wanted to point to one publication from Nur et al., where they have been doing probabilistic modeling of steady state microplastics in the GI tract. And it serves to put this connected together a little bit. Their work has demonstrated that the median abundance of steady state microplastics in the gut is around the side of 300 particles for children, 500 particles for adults. Now, that's estimated to be on the low side because we're lacking a lot of information on exposure. And they used a 0.3% intestinal uptake, which is in the middle part of that range that I mentioned previously. So there is some conclusions that are being made, but they need to be bounded by significant uncertainty at this point. So what I want to do now is transition into the human health or the health effects side of things and point to a few governmental or authority reports assessments that have been done. You see here the European Food Safety Agency, the German Risk Assessment Group, BFR, also the French agency, ANSYS, the WHO, and Environment and Climate Change Canada have all done health assessments, human health assessments for microplastics. And what is the type of data that they've been looking at? Here's a snapshot really of the studies. I mentioned earlier that there aren't a lot of studies available, but they are becoming available exponentially. You can see that the effects that are being reported really range from no effects at all and a whole variety of effects on the microbiome, oxidative stress and inflammation, more systemic effects such as on the thyroid system or male and female reproductive systems. There's a whole host of variety that you can see here and others that I won't get into. But these, at least to the extent that they were available at the time of the assessments, have been reviewed by these different authorities. And what did they conclude? They concluded that we need more data. They concluded that the quality of the data is also needing to be improved so that all scientists and regulators can be able to make conclusions. Ultimately, the goal of these would be a risk assessment for human health, but we need all aspects of exposure, uptake, distribution, identification of hazards, characterization of hazards that have been identified. And what we need is that we need these to be well-controlled, standardized, well-designed. So that's the conclusions that have been made to date. We've been trying to do our part in this area. So I'll just reference a multidisciplinary project that's been aimed at working towards part of the quality control and the criteria, identifying criteria for microplastic evaluations of studies with the goal of increasing the quality of future scientific studies. The goal of this tool has been to increase transparency, focus on relevance and reliability of microplastics human health studies, and identify critical criteria that either can be used to evaluate existing studies or incorporated into new studies. These include particle characterization, experimental design, applicability to risk assessment. And the idea with this tool is that it would be a initial screening tool whereby if studies were deemed to be fit for purpose coming out of that tool, they would proceed to an expert review prior to being considered for inclusion in a risk assessment. We've looked at 72 studies as part of this evaluation, and I'll run through some of the key observations going forward. So observation number one, current microplastic test materials are not representative in terms of what's largely been published. Most of what's in the publications are polystyrene reference materials 90% approximately of the publications. And notably, these have very limited information on what characterization of not only the particle, but the vehicle that is used as part of that particle. Notably, these, if you think of food contact and secondary microplastics that could come from food contact polymer products, there's a big difference because in those cases, even though it's not intentionally getting into the environment, the composition of those products is well known and well characterized. And in most cases, the components have gone through food contact evaluations. Additionally, again, most of these test materials are polystyrene, they're spherical, they're pristine. In the test systems that are used, typically these are on the millions and billions of particles in the test system. That's very different from what's in the environment. So this publication here talks about three factors: size, shape, and density. You can see that the size that's reported in the environment goes from 5 millimeters down to 20 microns. It probably goes lower than that, but as referenced before, analytical limitations exist in this space. Shape, there's a huge variety of shape. It's not just spherical. There's fibers, fragments, sheets, foams, etc. So we need better representation of this space and density as relation to polymer types. If most of the publications are on a polystyrene material, that's not representative of what's in the environment. And then in addition to that, the exposure currently is on hundreds to thousands, as I mentioned earlier. The particles are aged in the environment. This is very different from what's being used in the experiments. The second key observation is poor quality control. That really focuses on characterization and standardized study designs. I won't go through the details of these, but you can see that there's surfactants that aren't being accounted for, solvents, how the materials are being prepared and evaluated in the system. There's a need for robust study designs. So that is a key area of need. So just to summarize, where are we at and where are we going? Currently, the microplastics are not representative of what's in the environment. The quality of the publications are unfortunately low in totality. There are some good publications, of course, and the suitability then, therefore, is somewhat limited. Within 5 years, given the amount of research that's being conducted, we do expect to have a very significant improvement in all of these different parameters. That should allow us to have good understanding of kinetics, good understanding of hazard potential, so that we can do risk assessments. What do we need in this?
Wrap it up.
Yep, I'm on my last slide here. What do
Excellent.
we need? We need good collaboration between a diversity of scientists. Particles are different from individual chemicals. There's a lot of polymer chemistry that's needed. There's a lot of analytical chemistry that's needed. And it goes beyond this. So there's a big need for collaboration. And with that, thank you very much for your attention.
Thank you very much. Okay, so we do have a couple of questions. The first one is, you had talked a lot more about the size and the shape of the particles, but one of the questions was, is there any concern of potential synergistic effects of microplastics and heavy metals since they're both contaminants?
Yeah, there has been some reports about metals attaching to plastics. So that's an area, I think, of active research. And again, it's part of the universe of research that needs to be conducted. So again, I don't think there's a conclusion on that yet.
No. Okay, and one other, just quickly, what mechanisms have been proposed for the health effects that have been reported?
That's a good question. It's, I think, a little bit early to make conclusions there as well. But some of the mechanisms that have been proposed have focused in on the side of inflammation. So if you think of potential contact with these materials, they could cause inflammation if there's exposure for a period of time. That would be the most predominant likely mechanism, but Again, it's very early on, and we need good quality, robust study designs to answer these questions. I think it's one way I would pose it is I think it's good to understand what potential there are for any effects and what they are, and then work backwards towards the mechanisms by which those effects could occur. So I think of it from a, let's describe what can occur, and then let's understand specifically the mechanism by which that does occur.
Thank you very, very much.
Thank you.